Vitamin E is widely celebrated for its antioxidant properties, but its role as a mild yet meaningful anti-inflammatory agent is equally important and deserving of attention. Inflammation is a natural and essential process that the body uses to protect itself from injury, infection, and harmful stimuli. However, when inflammation becomes chronic or excessive, it can contribute to the development and progression of numerous health conditions, including arthritis, metabolic syndrome, cardiovascular disease, and many others. In this context, vitamin E's ability to gently modulate and reduce inflammation offers promising benefits that support long-term health and well-being. Chronic inflammation is often characterized by the persistent presence of inflammatory molecules and immune cells in tissues, leading to ongoing damage and dysfunction. Vitamin E helps to calm this process by influencing the production and activity of inflammatory signaling molecules, known as cytokines, which orchestrate the immune response. By downregulating the release of pro-inflammatory cytokines and promoting anti-inflammatory signals, vitamin E helps to restore balance within the immune system. This balancing effect means that while the body can still mount necessary inflammatory responses to injury or infection, it is less likely to suffer the damaging effects of unchecked, chronic inflammation. One of the areas where vitamin E's anti-inflammatory properties have been particularly well studied is in arthritis, a condition characterized by painful joint inflammation and stiffness. In arthritis, the immune system's inflammatory response targets the joints, leading to cartilage degradation, swelling, and pain. Vitamin E's antioxidant and anti-inflammatory actions can reduce oxidative stress within joint tissues, protecting cells from damage and alleviating inflammatory pathways that exacerbate symptoms. This can translate into improved joint comfort and mobility for individuals living with arthritis. While vitamin E is not a standalone cure, its ability to support joint health and reduce inflammation can be a valuable complement to other therapeutic strategies. Metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels, is another area where vitamin E's anti-inflammatory effects may have a positive impact. Chronic low-grade inflammation is a key driver of metabolic syndrome and related disorders such as type 2 diabetes and heart disease. By reducing inflammatory markers and oxidative stress, vitamin E supports the body's metabolic processes and helps protect organs such as the liver, pancreas, and blood vessels from inflammatory damage. This supportive role contributes to better regulation of blood sugar, lipid levels, and blood pressure, ultimately lowering the risk of serious metabolic complications. Furthermore, vitamin E's anti-inflammatory effects extend beyond arthritis and metabolic syndrome, benefiting a wide range of inflammatory conditions and chronic diseases. Inflammation plays a central role in neurodegenerative diseases like Alzheimer's, autoimmune disorders, and even certain cancers. By modulating inflammatory responses and protecting cells from oxidative injury, vitamin E creates a more favorable internal environment that promotes healing, resilience, and cellular health. An often overlooked benefit of vitamin E's anti-inflammatory action is its contribution to skin health. Chronic inflammation can accelerate skin aging, exacerbate conditions like eczema and psoriasis, and impair wound healing. Vitamin E helps soothe inflammation in the skin, reducing redness, irritation, and damage caused by environmental stressors such as UV radiation and pollution. This calming effect enhances skin repair and regeneration, promoting a smoother, healthier complexion and protecting the skin's natural barrier function. Importantly, vitamin E's anti-inflammatory properties work best when combined with a balanced diet and lifestyle that support overall health. Nutrients like omega-3 fatty acids, vitamin C, and polyphenol found in fruits and vegetables complement vitamin E's effects, creating a synergistic network of antioxidants and anti-inflammatory compounds. Together, these nutrients foster a systemic environment that encourages healing and protects against the chronic inflammation that underlies many diseases. Incorporating vitamin E through natural dietary sources such as nuts, seeds, green leafy vegetables, and vegetable oils ensures a steady supply of this beneficial nutrient. For individuals facing specific inflammatory challenges or increased oxidative stress, vitamin E supplementation under professional guidance can provide additional support, enhancing the body's capacity to manage inflammation effectively. Ultimately, Vitamin E's mild anti-inflammatory effects are a powerful asset in the pursuit of health and longevity. By gently tempering inflammation, protecting cells from oxidative damage, and supporting immune balance, vitamin E helps prevent the harmful consequences of chronic inflammation and contributes to the management of conditions like arthritis and metabolic syndrome. Its role in calming the body's inflammatory processes adds a crucial dimension to its health-promoting profile, making vitamin E an indispensable nutrient for those seeking to maintain vitality and resilience throughout life.